everyone. Thank you for joining this first DGHI Think Global webinar of 2021 spring semester. I'm Sumi Ariely, Associate Professor of the Practice at DGHI. I came to the Institute in 2008 and focus on developing and supporting grassroots community health projects abroad and here in North Carolina. Our webinar today is about stress and resilience in the lockdown. Quarantine and stay-at-home public health measures, which are so important for controlling COVID, also pose significant new stresses for families and individuals. The panel today will discuss research and perspectives on how people in Durham and surrounding communities are navigating the challenges of the pandemic, including consequences on mental health, nutrition, and family dynamics. I'd like to mention too, as the Global Health Institute, we care deeply about health disparities wherever they occur, which includes, of course, in our own neighborhoods and communities here in North Carolina. I'm currently serving as DGHI's faculty point for Durham-based collaborations, and so we're especially happy to have a specifically local focus to our discussion today. As a reminder to our audience, you can put questions in the Zoom Q&A tab at any time during the discussion. We'll be monitoring those questions and we'll get to as many as we can during the conversation. I'd like to introduce our panelists now. We have full bios if you'd like to read more about each one of them, but I'll just say a few words for now. So Anna Gassman-Pines is Associate Professor of Public Policy and Psychology at Neuroscience at Duke. Her research focuses on the effects of welfare and employment policy on child and parental well-being in low-income families. Welcome, Anna. We also have Carmelita Karhoff, who is a founding member of Dementia Inclusive Durham, DID, a grassroots volunteer collaborative dedicated to enhancing the well-being and quality of life of persons living with dementia. She also currently serves as director of a federally funded project that works to catalyze and strengthen dementia support systems and services here in Durham. Welcome, Carmelita. Next, I'd like to introduce Lindsey Miller. Lindsey serves as a research analyst for Healthy Eating Research, a national program of the Robert Wood Johnson Foundation based here at DGHI. Lindsey works closely with Dr. Mary Story and conducts research on environmental and policy strategies to promote healthy eating, especially among racially and ethnically diverse populations, especially those at highest risk for poor nutrition-related disparities. Thanks for joining us, Lindsey. We're also joined by Amber Rieder. Amber is a second-year global mental health postdoc at DGHI and at the Duke Institute for Brain Sciences, working with Drs. Eve Puffer, Lauren France, and Geraldine Dawson. Amber's interested in community-based approaches to mental health assessment and interventions, both locally and globally. So Amber, let's start with you. Your research has been collecting data across 18 southern US states, surveying the parents of young children and how their families are faring during the pandemic. Could you tell us a little bit about who you surveyed? And as you're starting to analyze the data, what are some of the themes you're seeing in the results so far?
Yes, for sure. Thank you, Dr. Ariely. It's been a real pleasure to be here and have the opportunity to share a little bit about our work. And I'm really excited to hear from the other panelists today. So it's an honor to be invited. Thank you. Today I'll be sharing a bit of our family survey work that we conducted with the Puffer Lab. And as a global mental health lab, we're really interested in working with parents and families and children in their own communities across diverse settings. So we conducted an online survey of parents across the 18 southern states. And we're beginning the analysis now, but we're excited to share some of our preliminary results with you. Approximately 1,500 parents completed our survey, which represents about 1,800 children, and the children range in ages from 3 to 16. And they participated in our survey online over the course of the first 6 months of the pandemic. Even in our preliminary analysis, though, we're seeing an impact of the lockdown for many families across the family system. So 3 of our key findings so far are that first, parents are reporting their own significant mental health concerns. More than 50% of parents are reporting at least mild symptoms associated with depression, with another third of families reporting more significant depression symptoms that are more in line with clinical severity. 33% of our families also screened significantly for anxiety symptoms on our screening tool, and that's a little bit higher than we would have expected. Our second major finding is that parents are also reporting social, emotional, and behavioral difficulties with their children. 3/4 of parents reported that at least one of their child's mental health and well-being had deteriorated since the start of the pandemic. And of those, approximately 55% of parents are expressing moderate concerns, or 20% endorsing that their child's well-being got a lot worse since the pandemic started. And finally, one of our third finding is that parents are reporting deterioration of relationships in the family overall, and these are including both partner relationships and parent-child relationships. But across these three findings, we can see that families are feeling a lot of stress around the pandemic itself, and this stress is certainly contributing to the struggles in terms of mental health and family cohesion. Two salient examples of this are more than half of the parents are really struggling with balancing work and childcare responsibilities since the restrictions started. And nearly 3/4 are feeling a lot of stress about the government response to the pandemic. And I should note that these data are echoed in the emerging mental health data that are coming out across the globe, but our study will contribute to the knowledge of how families in North Carolina and across the South more broadly are coping. The South is unique and somewhat understudied in a lot of ways, and our data is rich and includes a breadth of questions and topics that will allow us to explore what predicts which families have maintained their well-being, because a lot have, and which ones are struggling.
Thank you, Amber. That's really very interesting, and I'm looking forward to coming back to that. Anna, your work has many connections with this as well. You've been surveying a group of retail, food, and hotel workers in Philadelphia, even since before the pandemic began. You're serving them on work conditions and also, like an Amber study, family mental health and well-being. Can you share a bit about what you're finding and the impacts of the financial instability everyone, right, all of us, but especially many of the service industry workers have been facing before and also during the pandemic?
Absolutely, and thank you so much for having me today. I have been following a representative sample of retail, food service, and hotel workers in Philadelphia, all of whom had young children between the ages of 2 and 7 back in the fall of 2019, so before the pandemic started. And as we followed these families longitudinally, a lot of our findings actually echo what Amber just presented, and I think shed some light on the factors in particular that are driving a lot of stress for low-income families who were already having a lot of instability even before the pandemic started. So one of the things that we do is field detailed daily surveys over a period of time. And we happen to be doing one of those waves of detailed daily survey collection starting in mid-February and throughout the announcement and enforcement of these restrictions related to the pandemic. And what we were able to see with those daily data is, one, just how quickly these parents lost access to work. So work hours plummeted very dramatically as soon as the lockdowns and stay-at-home orders were announced. And two, parent stress also went up very significantly almost immediately after these restrictions went into place. And we have subsequently followed up with families using one-time surveys where, similar to what Amber presented, in half of our families, the parent is screening positive for either major depression, anxiety, or both. So in the case of these service workers who were already having a lot of precarity and instability in their economic well-being, the pandemic has increased that instability in intensity. And so they have experienced loss of hours, loss of income, and those are strongly related to feelings of stress and mental health problems.
Thank you, Anna. Lindsey, let's move to you. So related to the effects of economic and financial instability Anna just spoke to, many experts had feared early on that the COVID-19 crisis would quickly become a world food crisis around the globe and a nutritional crisis here in the US as well. It seems those fears were unfortunately pretty well grounded. Can you give us a sense of how the pandemic has affected nutrition and food security here in the US?
Absolutely. Thank you for having me today. So pre-pandemic, nearly 11 million children lived in a food insecure household, and child food insufficiency rates have skyrocketed during the pandemic, reaching 19.9% in mid-July in 2020, compared to 7.7% of children who were food insecure at the same point in 2018. For many children in America, nutrition and food insecurity are closely related. One of the biggest impacts on children right now is the lack of consistent in-person schooling, and therefore the reduced access to school breakfast and lunch. Pre-pandemic, some children were consuming up to half of their daily calories at school. You then partner that information with the fact that school meals are significantly healthier than those consumed at home, specifically for children from low-income families. Since updated nutrition standards were implemented in 2012, school lunches have become 41% healthier and have had a positive impact on children's diets. But despite innovative efforts by schools in the spring, over the summer, and the school year to provide children with meals, one study found that during a 9-week period in the spring, 1.15 billion school meals were missed. Another estimate suggests that only about 15% of low-income households with children who qualify for free or reduced price school meals are receiving them. So in summary, there are really three major concerns right now related to child nutrition and food insecurity. The first is the lack of consistent access to healthy foods. And two, the potential for children to have reduced food intake and going hungry, specifically those in very food insecure households. For reference, about 1/3 of all food insecure households are very food insecure, which means that their meal patterns are disrupted and food intake is reduced. And the third major concern is that the pandemic has affected the nutrition of children across America, but as Amanda and Anna have alluded to, it has disproportionately impacted children from low-income families and has only further exacerbated disparities in America.
Thank you, Lindsey. We're going to come back to all of these issues. I'd like to move a little bit now to the other end of the age spectrum. Carmelita, we've just heard a lot about the instability the pandemic has instigated, and we know a lot about how stable social, physical, economic environments are key factors, right, in supporting mental, physical well-being for everybody, but especially critical for the youngest and oldest age groups. In your work with Dementia Inclusive Durham, you see firsthand the challenges people living with dementia and their families face on a daily basis in the best of circumstances. COVID-19 and the stressors of the lockdown have probably pretty likely added significant additional challenges. Can you tell us a little bit about your work and how people living with dementia have been faring during the pandemic? I think you're still muted.
Thank you again so much for the opportunity to join you here today and for DID to be able to share the information that we have. And thanks to Anna, Amber, and Lindsey for the information. I am inspired with all of the work that you're doing. So Dementia Inclusive Durham is 5 years old. And it is primarily a grassroots volunteer collaborative of persons, professionals, volunteers, homeowners, care partners, and organizations here in Durham County. We don't have the capacity to do all of the research at this time to be able to maybe present quantifiable data. So in preparation for this conversation today, I reached out to friends and colleagues within the network of Dementia Inclusive Durham. So when I'm talking about the network, it means those individuals who represent the different sectors across the community and the different services, because they're the only ones that we can get information on what's happening in the community. Dementia Inclusive Durham does not have a direct care partnership with persons with dementia. So we base our information and plans for action on the information that we get from these partners. So the suggestions and perspectives that I received from all of these individuals were, I have to say, very sobering. I was thinking that maybe there is, there is definitely a great need for looking at this situation at the moment. But what is coming up as evidence is really strong to date, indicating that persons with dementia have a high risk, number one, medically, of contracting COVID-19, and once infected, have a high risk of disease-related morbidity and mortality. And why is that? In persons with diminished communication and comprehension skills, they may not be able to appreciate all of the precautions that is recommended at this point for prevention of infection. And at the same time, the impact of isolation on those that are already being challenged, we could not even comprehend. The prolonged periods of this isolation to prevent the infection, that has been a great global recommendation as far as prevention, but it had a major effect on those that are living with dementia. And studies have shown that they have extremely created high risk of worsening interaction disturbances as a direct result. And when I use the word interaction disturbances, in the local term, that would be, quote, what is called behavior, which we try to avoid. On the local side, on the local end, the information were primarily anecdotal, but they all follow the same concern: increase in morbidity and mortality, huge challenges for those living alone, especially. And in our very informal preliminary analysis about 5 years ago, there are about 800 people living in Durham alone who are living with dementia, and we don't even know where they are, or the system is not strong enough to identify those individuals. So that's a major problem and a major need at this point. Additional suggestions to think about are possible increase in unintended abuse, with the fatigue and stress and exhaustion that families and caregivers are experiencing at this point. Words are said, actions are made, neglects that are unintended happen, and the consequence of that is not something that we could even measure at this point. On the medical side, which I have to really appreciate a couple of physicians who weighed in on this, and combining their practice in long-term care and their own clinical practice. They've seen unintended, again, elder abuse. And the interesting part is the issue of self-neglect, because that person with dementia could not really comprehend what is going on. So consequently, there is the whole challenge of their not being able to take care of themselves. There's definitely depression, increased agitation, weight loss, failure to thrive, decline at a, quote, at a precipitous and unexpected rate over the past year. So when I say sobering, I couldn't even tell you how all of that information affected me. But in a way, it's an inspiration to see we have work to do. And I'm glad to hear that Global Health Institute has a Durham section that perhaps at some point in time we can connect. And working together, we're not going to solve the problem, but we definitely can enhance the well-being of those living with dementia. Thank you.
Thank you, Carmelita. It's a lot of different factors that you brought up. And I think as global health workers, we often see the many cascading negative effects, right, of not just this pandemic, but any type of crisis events. Lindsey, are there longer term, similar to how Carmelita has been framing the issues for patients living with dementia, are there longer term repercussions you and the team are worried about? For example, like the relationship between food insecurity and nutrition related health problems, like childhood obesity?
Yeah, absolutely. So childhood obesity rates have actually been on the rise in America for the past 4 decades, with more than a third of all youth under the age of 19 classified as having overweight or obesity. Current literature suggests that food insecurity may increase the odds of obesity in children and adults. And some data say that the odds of a child being obese are 5 times higher for children from food insecure households compared to children from food secure households. And circumstances caused by the pandemic will likely increase the prevalence of obesity, mainly due to the fact of children not being in school regularly during the week. The most relevant studies we have on this are on unhealthy weight gain during the summer months when students are out of school. For example, a study that followed children over a 3-year period found that the prevalence of overweight and obesity increased only during summer recesses, and that this weight gain is particularly apparent for Hispanic and Black youth. And there are 3 major ways the pandemic could impact childhood obesity. The first is that by not being in school, there are fewer options for students to be physically active and therefore likely have more sedentary time. The second is, as discussed before, meals consumed at home are not as nutritious as meals consumed at school for many students. And the third is that by being at home, there are more opportunities for the environment in which a child lives to impact their health. For example, research conducted by Poonam Orivachespati showed that over time, having additional convenience stores in a child's neighborhood had a negative impact on their weight status. Children are more likely to go to these kinds of stores in their neighborhoods during extended school closures. So I have to add the disclaimer that we don't have the data available on this now, with obesity being such a long-term outcome. But given the information we do know, there is reason for concern that childhood obesity rates could increase due to the COVID-19 pandemic.
Thank you, Lindsey. And just as a reminder to our audience, feel free to post questions in the chat and we'll monitor those as well. So given all of the issues around school closures and obviously the nutritional related, food insecurity related issues, there are a lot of behavioral issues that have been coming up too. And both Anna and Amber, you alluded to some of those. Amber, in your study, you told us parents were expressing a lot of concern about their children's behavior. What are the kinds of things that they're reporting? What are parents saying more specifically about how their children are doing?
Yeah, parents are reporting concerns about their child's mental health actually across a broad range of domains, which include emotional, behavioral, attention, learning, and social. Unsurprisingly, the concerns that parents endorse the most are falling under emotional difficulties, where just under 50% of parents are reporting concerns, and then behavioral difficulties. Unsurprisingly, all of the challenges that parents are facing, approximately only 16% or just under 300 parents reported deterioration in their relationship with their child. And in terms of parents who have adolescents, parents are reporting feeling a lot more concerns about increased alcohol, drug use, and sexual behavior during the pandemic. But all of that being said, the good news is that the vast majority, 86% of parents are reporting at least a stable or an improved relationship with their child.
That's really nice to hear some of maybe some unexpected positive outcomes, and let's make sure we come back to that later as well. Anna, you described how unpredictability in work schedules and government policies on stimulus support can affect families and influence, right, the concerning levels of anxiety and depression you're also seeing in your study. Have you seen differences among the 3 broad industry groups you surveyed, hotel, retail, and food? Is that right? Are you seeing any differences between those industry groups that could give us hints about either extra risks or resilience factors that could speak to what policymakers could do better?
So we don't have a lot of detailed information yet about differences between those groups, but what I can say is that our folks who are working in food service were much more likely to continue to work during the pandemic, as you might imagine. And the number one thing that these families need is income. When we ask people about income loss, the majority of our families have experienced income loss since the pandemic started. That includes folks who are still working. And there are a lot of reasons you might imagine why that could be. If you're working in food service and you were relying on a lot of tips and it's slower, you may still be employed, but you aren't making as much, or you may still be employed, but not get as many shifts. And what that means for families is that they are largely struggling around the basics. And I think this alludes to what the other panelists have been talking about, things like worrying that they aren't going to be able to pay their rent or have enough money for food. So when we talk about these families needing additional income, you know, as you mentioned, we've all felt the financial impacts of this crisis. But for families who were already struggling, what that means is really a challenge with affording the basics, and not, you know, cutting back on luxuries, for example, that you or I might have had to do. And policy can make a difference here. So we saw, for example, in data that we collected in May and early June, which was kind of at the peak of the federal response that provided financial supports to families in a variety of ways, that buffered some of the most severe effects on income across all of our families. But by the fall, those programs had largely ended, and the effects on family income were quite dramatic. And so we were able to see both how a federal, robust federal response could buffer families, and then when that was taken away, that it really led to even larger declines in income.
Thank you. We do have a question from one of our participants, just in terms of asking about if the results of all of your work is going to be published or available soon. I know some of you have already published and has come out, but it sounds like people are really interested in this information and areas where they can access it more. So maybe just a quick shout out, or we can put it in the chat, or provide links to that later. Does anybody want to just give some information about where we can find more?
I'm happy to start really quickly. I had a paper published in Pediatrics that came out in August that really lays out those immediate impacts on both parents' work and mental health, as well as some effects on children's mental health as well. I've also published a set of policy briefs that are all available through the Center for Child and Family Policy website, and you can find those on there.
That's great. So building on some of the policy recommendations, Anna, you were talking about, Lindsey, could we ask you how the healthy eating research has been able to keep tabs on nutrition needs and advocate for policy adjustments?
Absolutely. So in March 2020, Healthy Eating Research, which we call HER, launched an ad hoc work group in response to the COVID-19 pandemic in collaboration with the CDC's NOPRIN Coordinating Center. The work group was developed to provide space for public health nutrition researchers, advocates, and practitioners around the country, including here at Duke, to collaboratively engage in research and policy efforts to support food access and security for school-age children during the pandemic. The work group has been active for almost a year now and has grown to over 500 members, including roughly 200 students and early career stage investigators, representing more than 40 collaborative organizations. Monthly meetings of the full work group consist of policy updates from collaborator organization, research presentations, and advocacy organizations such as Food Research and Action Center, Center for Science in the Public Interest, and the NAACP. Various subgroups of members have also formed for those who want to focus on specific topics and projects such as pandemic EBT and strengthening the summer food service program. And collaborative efforts through this work group have led to the development of data collection repositories, peer-reviewed research articles, research briefs, case studies, practice papers, op-eds, fact sheets, and much more. There are many examples of how this work group has been able to respond to nutrition needs with rapid research to inform policy. policy. But one specifically, for example, is the pandemic EBT and meals to go surfaced as the primary interests of USDA and local school food directors as strategies to get meals to children early in the summer of 2020 or late spring. And this topic was discussed early on in the work group as little was known about the operational and financial challenges or the effectiveness of each strategy. So a subgroup was formed to do a deeper dive on the topic, and the subgroup received funding from HER to compare the PEBT and meals to go policies and conduct a cost effectiveness analysis of their effects on food access and food security for school-age children in the United States to inform efforts to increase food security for children when school is out in the summer or during future crises. And so these findings, which are expected in the next 2 months, will have significant policy and program implications. So this work group has really been able to serve as kind of a feedback loop with researchers, practitioners, policymakers, and advocacy organizations.
That's great. Thank you. That's great to hear. Carmelita, what about you? We often see the role faith groups and community networks can play in supporting older and vulnerable adults in other countries. What do you see as a potential role of community organizations like faith groups, schools, maybe police and security services in advancing better dementia care here in Durham or impacting policy?
The partnerships with these different organizations, we've considered the greatest gifts to our project at this point, because we recognized right off in the beginning that we cannot function on our own, and that these organizations, faith communities, families, neighborhoods, organizations, academic groups like you and the students at Duke especially, those are the ones that can really make a difference, because in one form or another, each of those representatives of those organizations have an impact or have a way to be connected to a person with dementia. So if we talk about the faith communities, it is very easy to understand that they have congregants who are living with dementia. So to the extent that we can influence a shift in their thinking into perhaps expanding their support to that person with dementia beyond medicine and into the humanities side of it, that is a little bit easier to do. But when you start thinking about the police force, what's their understanding on why they are called at 3 o'clock in the morning because there's a problem, quote, behavior. So to the extent that we can influence their thinking that there's another way of looking at that behavior, that is really what we're hoping to happen across Durham in our use of these organizations. And of course, I have to really say that we've been very blessed this past year to have a lot of Duke University support, and most especially, the most exciting that I have at this point are the student volunteers. So they've come forward, and perhaps it has to do with what the world is in right now. Perhaps it has to do with pandemic or just the general need to be of help. But they're stepping forward and offering whatever they can do. So using that, we are creating a school sector as an example because they can really make a difference. So using the students as an example. Thank you, Sumi, for connecting us with one of your grad students to help us in messaging. That's an example. We have undergrads who are going through training in creative engagement, and that means being able to have a conversation with a person with dementia in the moment for that person with dementia, knowing how best to start that conversation, because there's a creative way to make it a really positive experience for that person with dementia. All of the processes that we are developing cuts across all of these sectors. So I mentioned creative engagement. Can you imagine what would I say, a grocery person, being knowledgeable on how to ask the question in the right way for possibly a shopper who may be challenged with cognitive abilities. And that may be a very simple example, but that's the goal that we have, is that across Durham, the feeling of including, of being inclusive of persons with cognitive challenges is our culture. I don't know if I answered what you were asking for, Sumi, but that's basically the general idea of that sector approach, of including all of the organizations that you mentioned. And we have listed 12 of them, by the way.
No, that's great. And actually, Carmelita, if I could follow up with you a little bit more, I remember in one of our previous conversations, you had mentioned the origin story of how DID had started, and the many factors beyond the medical factors that you touched on earlier that helped launch the work. Could you just tell us quickly about how a family member's concern about her mother and herself triggered the efforts of DID?
Yeah, that's been one of my most favorite stories, and friends would say, don't get her started in that conversation again. But anyway, it was June 15th of 2015, and June 15th is recognized across the globe as a World Elder Abuse Prevention Day. So I was serving as a long-term care ombudsman for Durham County at that time. And in recognition of that critical day, we co-sponsored with the Adult Protective Services in Durham a community forum and invited the community, educators, whomever is interested in that topic to come and join us. We had speakers talk about elder abuse. And it was very well attended, very well received. And at the end, the last question that was posed to the participants was, what do you think in your mind is the biggest risk for elder abuse? And a daughter who had a mother with her at that forum stood up and raised her hand and said, taking care of someone with dementia. You could never appreciate what we go through, and we do not know what to do. So myself and the volunteers listened to that. And after the forum, we came together and said, okay, are we all in agreement that if we don't do something, we are just as guilty of neglect? A couple of months later, we got the approval to start a collaborative, and Dementia Inclusive Durham was born, addressing that issue.
Yeah, thank you. Thank you. And Amber, that reminds me a little bit of some of the work your survey was finding as well in terms of interpersonal conflict within families, maybe alcohol use and how that might lead to interpersonal violence.
Yeah, so we've been looking at family conflict at multiple levels, and at the overall family level, we're seeing that half of families are reporting, major consequences from COVID-19 that have negatively impacted their household and certainly impacting the way that families are interacting. About a fifth of families feel that their family overall well-being has deteriorated, which maybe isn't as high as we expected given how families are sort of living together in these conditions right now. But what this does mean is that the majority of families are reporting about the same as they were before. So I think we're seeing a good slice of families affected. Some of the family conflict items that were most heavily endorsed were really more around not being able to talk to each other and communicate about their feelings and sadness. And also making decisions for their family was a problem. But in terms of partner relationships and conflict, approximately a quarter of our sample reported difficulties with relationship and that their partner relationship had deteriorated. They were reporting that they're yelling at each other more and criticizing their spouse, and also a large proportion feeling withdrawn from their partner. Parents are reporting an increase in physical violence during the pandemic, but the rates for our sample are under 7% for increase in violence, and only a small number, 4%, reported feeling unsafe in their home. The data collected around family violence in our survey is a little bit limited, though. We prioritize the safety of parents who are primarily mothers who are completing these surveys online, which yields these unintended but potentially serious consequences. So we know that families who share computers and device, and including questions around violence in the home, could potentially increase risk for violence. So we've thought very carefully how we ask those questions, especially in the context of online data collection. In terms of alcohol, we are seeing that about a third of our families have reported changes in alcohol use, and of those, the vast majority have shown an increase in alcohol use. And surprisingly, over 50% of our sample met criteria for problematic drinking on our screening tool, but we're a bit cautious about those findings, and we suspect it might overstate the case a bit, because it looks like only about 10% of families are binge drinking, which means they're drinking 6 or more drinks on a regular basis. So it looks more likely that families are just having 1 or 2 drinks with more frequency. So maybe, and you kind of hear this a lot anecdotally, but when you work in the place that you live, sometimes ending the day with a drink is a way to separate your work life and your afterlife. And parents are reporting that. We need to dig into more to see and adjust for some of the demographics, but so far we aren't seeing really clear patterns or associations with problem drinking and any of the family, parent, or child outcomes. We will, however, be looking to see whether certain combinations of family difficulties might contribute, and this is a really important question for us to continue to answer.
Thank you. So given that, I'd like to ask all of you, we've touched a little bit about this already, but given the specific challenges you're seeing within the samples and within the topic areas you're focusing on, what are some both areas of resilience or, for example, Amber, in your case, coping strategies that you might be seeing, but across the panelists, specific ideas of what we can do to foster at the grassroots level and at the higher level policy recommendations and changes that could really make an impact. And all of you have touched a little bit on that, but be great to hear what your thoughts are on future next steps that all of us could be doing. Amber, we could start with you if you'd like, or anybody else can jump in first.
Sure, yes. I can talk a little bit about our coping data and some of the positive emotions, which I think will play a role in some of the intervention work that we do in the future. So parents are coping in a lot of ways, and some of them are positive. Some of them are not as positive, such as the increased problem drinking that I mentioned. But we also found that parents are turning to work as a way to cope. Although, as Anna mentioned, a lot of people have lost work, those who continue to work are using work as a coping mechanism. And other parents are reporting coping by strategizing, taking action, getting advice from people they trust, praying, and trying to see the positive in the situation. On the whole, parents are choosing multiple positive strategies to cope, which is really great. We also measured hope, and hope isn't always exactly what you think it is, so I'm just going to define it. And hope is a positive cognitive state based on the sense of a successful goal-directed determination and planning to meet those goals, which I can imagine is really hard during the pandemic with all of the restrictions. So we are noticing that about 50% of our families, just over 600 families, are reporting a reduction in hope. But interestingly, families are reporting feeling a lot more gratitude. So nearly 70% of our families, or 1,000 families, are feeling more gratitude. And we find that hope and gratitude both negatively correlate with symptoms of depression and pandemic stress, which makes a lot of sense. So the greater the depression or the higher the pandemic stress, the less likely parents are to report feeling gratitude and hope. So I think those are really interesting targets for intervention.
And I can just build on that, Amber. With the families that we've been surveying, we don't ask exactly the same questions, but we do ask at the end of our survey, an open-ended question: what else do you want to tell us? And a lot of the families in our sample are trying to find positive aspects of this crisis, recognizing all the challenges, but many of them, for example, expressing gratitude for this time that they've had with their children, even though it's been, complicated and stressful, that it has been, for many families, something that they can recognize as a gift for which they are grateful. And I just want to echo your point and say that, to the extent that practitioners, service providers, and others who have touch points with families and caregivers more broadly, really trying to tap into that gratitude as one type of intervention strategy seems particularly potent.
Yeah, I think I can jump in here. I think that since I have talked a lot about school meals today, I'll just add a few innovative ways that schools and communities have tried to fill gaps and get meals to families. So just quickly, some background information. Pre-pandemic, the school lunch programs provided 30 million meals to children on average every day. And of these 30 million, 21.5 million were from low-income families. And I want to start off with these numbers to try to paint the picture of how many families we're talking about that depend on the school lunch programs, and therefore the inherent operational challenges and just challenges the school food directors and support staff are currently facing. But despite these challenges, several mechanisms have been employed to try to meet the needs of children and their families. So schools have implemented creative strategies such as meal pickup sites where families pick up 2 meals for their kids, or boxes of foods, maybe enough for a week or 2. And these boxes are either available for pickup or they're dropped off. And we've even heard stories of some school systems using school buses to deliver school meals. But USDA has also granted waivers at the federal level. For example, pandemic EBT provides families who lost access to free or reduced price school meals due to school closures, and they put money on a new or existing EBT card. So from March 2020 to September 2020, PEBT provided nearly 10.7 billion in nutrition benefits to families who lost access to free and reduced price meals. Another federal waiver includes free meals, which is a USDA nationwide waiver to allow meals to be of no charge at all to students. And financial concerns were a huge barrier to schools in the beginning of the pandemic. But this enables school districts to increase their efforts and reach more students. However, this waiver will expire on June 30th, 2021. So advocates are really pushing for the expansion of this because existing literature on free meals suggests that this strategy increases school meal participation while having no negative impact on the nutritional quality of school meals and no change to the costs of meals to schools.
Thanks, Lindsey. Anna, I wanted to ask you too, just given the policy issues that Lindsey was mentioning, did policies work in providing families the support they need? Can you talk a little bit about that? What worked, what didn't?
Sure. So, I think there's actually emerging evidence. It seems like almost every time I search, I'm finding a new paper. But emerging evidence that yes, the set of benefits passed through the CARES Act, which passed in April and was rolled out through the spring and summer, did help stave off some of the most severe income losses and most severe economic consequences for families. So these interventions included the one-time stimulus checks, expanded eligibility for unemployment insurance and more generous unemployment insurance to support the economic well-being of folks who had lost employment. And the evidence is increasingly clear that set of supports did make a difference. But as Lindsey alluded to with regards to the supports for nutrition assistance programs, they were one-time, time-limited interventions that have ended, and in being time limited actually generated additional stress for many recipients who were well aware of the fact that these benefits were going to end and were quite concerned about how they were going to make ends meet when the benefits expired. And work in the service sector is still quite difficult to come by. And so when you hear folks in the policy world talking about so-called automatic stabilizers, one of the things that automatic stabilizers are meant to do is to address that unpredictability, to say we are going to set in advance, not in the middle of the crisis, but in advance, a set of rules that will guide when unemployment insurance should become more generous. And that will then happen automatically so that it is it can be communicated, well understood, and be predictable for recipients. And our research is showing that policies that can both support families' economic needs, but also be predictable will be the most effective.
And Lindsey, you were speaking to this as well, just in terms of some of the broader based changes that we can make that might mitigate the effects of these kinds of issues in future pandemics. Hopefully not, but we're likely to see crises continuing on. Carmelita or Lindsey, do you have anything to add on some of those policy recommendations or ideas of support?
Yes, thank you. It inspired listening to all the possibilities. So our hope for that person living with dementia is that it be recognized as a public health issue. It's very clear in Durham at this point that it is not. So to the extent that we can get support in making that happen, and we can get support in doing research as an example of the benefits of the interventions that we are advocating for, getting support in training and education, because we firmly believe that education, the right type of education, would make a huge difference in how this community, this Durham County, can really be inclusive of those persons with dementia. There has been a request from the network about this, and what they're hoping is that there will be some partnerships and a joint conversation. Let's look at what is happening here. In our very informal analysis of probabilities for persons living with dementia in Durham 5 years ago, it indicated that about 3,000 persons are experiencing or living with dementia in Durham County. That number has got to be increasing in tandem with the aging population, such as the data from the World Health Organization, the Alzheimer's Association, and the North Carolina data itself is supporting that premise that this number is going to grow. And until such time as we can get support in sitting down together and talk about this reality. We are very fortunate here in Durham that we have Duke as an amazing medical system that can help look at the medical side. What we are looking for to add is the human side of it. And of course, at this point, I really have to share with you one of my biggest, best, and dearest quote from Dr. Atul Gawande in his book, The Immortal. And he said, "We've been wrong about what our job is in medicine. We think our job is to ensure health and survival. But really, it is larger than that. It is to enable well-being. And it is that well-being that makes it possible for a person with dementia to wake up in the morning and say, hey, this is a good day. What can we do about it together?" That's the question.
That's really lovely. And since we're coming, it's a really nice segue too to ask Amber about some of the very specific intervention work your team is doing. It's really especially exciting to see the local global connection that Carmelita, you alluded to as well. And I'm especially excited about the cross-directional, bi-directional learning. So Amber, could you just quickly whet our appetite a little bit on some of the interventions that are based on models in low resource countries, how you might be applying those here?
Yeah, so we started the Coping Together initiative, which is a DGHI Global is Local initiative. And it's led by myself and DGHI faculty, Dr. Regine Preschel-Bell and Dr. Puffer. And we're working to bring family interventions that have been developed and successful in low and middle income countries to adapt here in the US with a goal of reciprocal innovation. We have a team in Kenya that has a vast amount of experience with these interventions and are now able to help us adapt similar interventions here in the United States. This work is based on a community-based participatory action research model. So we're working to find partners within our local Durham community to help co-develop and implement and adapt the intervention over the next year. So we held focus groups in the fall with family and child serving organizations to explore gaps and to begin to try to find partners within the community to administer this intervention with. Over the past few months, we've started to establish some relationships with some trusted community partners and are beginning the stages of development of a 3-tiered intervention. So it's very preliminary because we're co-developing, but the look of it broadly is that our lightest touch tier includes an adaptive text-based intervention that can provide psychosocial educational materials, family activities, monitoring prompts, especially to those who have difficulty accessing internet and devices that are stable for high flow data. The second tier intervention is a group-based family therapy that will be administered and trained by trusted community members. So these are lay provider models or peer models, which have been so effective in Kenya and in other sub-Saharan African countries. And these are peers of the community and they're trusted. So this is really important aspect of the work. And finally, our most intensive tier is an individual family therapy program that entails one-on-one work, again, with a lay provider selected by the community partner who's trained and trusted. And all of this will take place online in the context of the pandemic.
That's really great. So much good food for thought. And, you know, it'd be really interesting too, to figure out ways how to combine these interventions across kind of a whole family, a whole community, whole child network, right? Elderly care, nutritional support, work support. Just before we end, could we maybe go around and just any main takeaways, lessons learned, or future directions that you can share with us, each of you? Maybe Anna, could we start with you?
Sure. Yeah, I'm happy to start. So I think the main takeaway from my own work that I think was really echoed by the other panelists is that especially for lower wage workers in the United States, the situation pre-pandemic was already quite precarious with a tremendous amount of instability and unpredictability in especially work experiences, hours, and shifts that makes it quite difficult to balance the wide array of work and family demands, particularly caring for children, but also in many cases caring for elderly family members and other older adults in individuals' networks. And what the pandemic has really laid bare for all of us to see is just what challenging circumstances these essential workers were already in, how important they are for the everyday functioning for all of us, and how we need to think much more deeply about ways to support workers in both their work life and their caregiving needs as we move forward out of this pandemic.
I can hop in here and say that as much as we're seeing that families are struggling at all levels within the family, there's so much positive and unintended consequences of spending time together and communicating and working together as a family that I think this can really be drawn on in terms of intervention. And I'm really excited about being able to work here in Durham with peer providers, because I think it's really the only way that we're going to be able to access and meet the really underserviced populations, especially here in Durham. So I'm really looking forward to seeing how that unfolds over this next year and report back.
Yeah, I think.
Go ahead, Jency.
Okay. Okay, thank you. I think that the COVID-19 pandemic has really exposed 5 key policy and programmatic recommendations. The first one is to continue to expand online grocery purchasing for SNAP participants. I know we haven't had the chance to really talk about SNAP and WIC very much, but the second recommendation is to develop the technology and support needed to allow for online grocery purchasing for WIC participants. The third is to increase SNAP benefits. The fourth is continue pandemic EBT beyond the pandemic. And the fifth is to continue the free school meals waiver well beyond the pandemic. I think overall the lessons learned from the COVID-19 pandemic provide a critical opportunity to modify and strengthen existing federal programs and policies to better support the nutrition and overall well-being of children and their families.
And lastly, given the experiences and the information that you've all shared, and that what I've learned from preparing for this conversation, the one thing that comes to mind is we need champions. There's a lot of work that needs to be done, but we need that core group of individuals, organizations that can come together and share what are the opportunities that we can do to enhance well-being of everybody, for that matter, an elder adult or a child or a family. There are so many things that we can do, but perhaps many hands make light work. And so who's willing to champion this cause would be a big question. Thank you again.
Thank you so much, all of you. Those were just really interesting findings and great insights for moving forward. I really hope we can follow back up and also see how we can foster more collaboration across these different topics. So we're at the end of our hour. Again, I just want to appreciate so much Carmelita, Anna, Lindsey, Amber for your participation, and looking forward to following up and hearing more.
Thank you.
And also, just as a reminder to our audience, the next Think Global event is February 17th. The topic is AI, data science, and global health, and that can be registered for on the DGHI website. And then also, you may be interested in watching the David Rubenstein interview with Dr. Anthony Fauci for the DGHI Victor Zhao Distinguished Lecture Series. That's February 10th at 4:30 p.m. No registration required. The YouTube link is on the DGHI calendar. Thank you again, everyone.
Thank you.